Hello, everybody. Welcome to the No Prescription Needed podcast. This is episode 5 where we're talking about mental health. Welcome, Dr. Verma. How are
Hello,
you?
doing great. Glad to
Uh,
be here.
Dr. Verma, he reached out to me because he really wanted to talk about mental health. Um, what really stood out to me is that he also wrote this blog or article that we'll get to later. I'll talk about dealing with mental health while in pharmacy school. And I think that's something that we haven't touched on. We touched on dealing with mental health in terms of being a pharmacist and a technician, but we didn't talk about that as is related to a pharmacy student. So first, I'm going to show you a clip of Dr. Verma talking about mental health with Democratic presidential candidate Andrew Yang. So we're going to watch that now.
Hi, everyone. My name is Mudit, and my message is my mind is my temple. So a couple of years ago in the fall of 2016, I made a trip to the campus counseling center during pharmacy school. It was my first trip to getting professional mental health help, and the campus psychiatrist diagnosed me with an anxiety disorder. I adhered to the regimen and followed the instructions, but unfortunately I experienced a rare adverse side effect from the medication that was prescribed to me, and that side effect was mania. And for me, my manic episode consisted of several sleepless nights, lots of agitation, more anxiety, and I had very unrealistic mental hallucinations about aliens invading the world, and I needed help urgently. Also, I was very disruptive in class, so my classmates and my professors quickly got the attention of the campus psychiatrist, and the campus counseling center recommended that I seek more urgent treatment at an inpatient psychiatric hospital. That experience was very scary for me, and it was also scary for my family, especially since mental health is not talked about in South Asian and Indian American households. But ultimately, from going through that experience, I learned that prioritizing my mental health ought to come first, and prioritizing my mental health ought to come before any career advents or any given task, because I want to live in a world that is humanized and enables us to put mental health forward. And that is why I want to live in a world where our minds can be our temples. Thank you.
Thank you. Thank you. That's so
Mudit.
important. Thank you, Mudit. It's like Friday of Mental Health Awareness Week. And I couldn't agree with you more on so many levels. And it's awesome that now you're prioritizing your own mental health because right now, like, there's like a real pathological hyper-capitalist, stigmatizing of mental health issues where it's like, oh, if you're struggling, then you're not able to work. And if you don't work, then you're worth less. And that's what we have to break everyone free of. And it sounds like you're free of it, which is great. Like, like there are many circumstances where if you're not able to focus on your health, then it's not going to get better. So, but you seem freaking tremendous, I got to say. Like, you seem like the healthiest guy around right now. So congrats. And thank you for sharing because it's so important. I'm super passionate about mental health issues. And you're right also that in the Asian community, it's stigmatized even more to be struggling.
Thank you so much, Andrew.
Okay, and then they're gonna come back. Oh man, that was so cool. Andrew Yang, I really wish he got more support because he just seems like such a down to earth guy. How was it talking to Andrew Yang?
Yeah, it was truly an honor to speak with Andrew Yang. I was very involved in his campaign since late 2019, and I really liked his philosophy on the way he viewed work and life and how the economy can be reshaped to reflect human well-being. And one of his sort of selling points on universal basic income was to financially recognize types of work that don't go financially compensated today, such as parenting, such as artists. Both of us are comedians. And so I think that sort of problem-solving state of mind that Andrew Yang has really spoke to me. So.
Okay, well, tell us a little bit about yourself, and then maybe tell us a little bit about your journey with mental health going into being a pharmacy student.
Definitely. So I think for me, mental health, it's always been a passion of mine. So I majored in psychology in undergrad. And I never sought professional help for like my own mental health until halfway through pharmacy school, where I was really struggling both academically and also determining what career path to take. And it was a very turbulent experience because I saw the campus counseling center psychiatrist that prescribed me Zoloft for what she felt was anxiety. But then I had an adverse effect, which was a full-blown manic episode. So that opened this sort of this whole new area of my life, which was mental health, and that became so relevant in pharmacy school, not just from determining my career and managing the workload, but also the fact that my issues were coming to terms with like the best medication regimen for me. So everything was really coming full circle. And I also have to say that I think when I had my manic episode that came from taking that Zoloft, which I took as prescribed and as instructed, I think a lot of my personal triggers had to deal with a lot with the 2016 election. And so I think somehow politics has really taken this emotional place, in my mind and mental health. So I think pharmacy school has played a very integral role in all of that.
And that's something that I think people don't talk about, because I remember, I wouldn't say I was necessarily depressed, but in pharmacy school, people don't understand that it literally takes over your whole life. We'd have an exam on like heart failure on Tuesday, and then on Friday was like kidney transplant. So it was always studying, you're in class all day, and then you got to go to the library. And then when all your friends are out partying for the weekend, you really don't even feel like going out because you got so much work to do. And I remember I was also like president of APHA, Phi Delta. I was in Phi Delta Chi and SNAF and all this stuff going on. And I really felt like there was no resources. Like, at least there might have been resources, but it was never discussed. Like, hey, we have people you can talk to. Hey, are you overwhelmed? Like, how are you doing? And I don't know, what were your experience? Do you feel like there's a lot of resources for mental health in terms of like pharmacy school?
Well, I felt that, so there was one psychiatrist in the campus counseling center, and there was a psychologist as well as maybe one or two other professionals, maybe counselors and therapists of sorts. So the numbers, I don't think, met the demand at all in terms of the size of our pharmacy student body, which was about 150 or so students, 120 in our home campus in Baltimore, and about 30 or so in an off-channel campus. And then there are other programs, which are medicine, nursing, law, dentistry, etc. So I think it was a big issue on sort of the numbers and the supply and demand and the available, the raw sheer availability of resources and professionals to be able to attend to like the capacity of our needs. I think the sentiment was there. I think the mission was there as a campus, but I don't know that adequately translated to the sheer number of professionals and resources.
Okay. Talk to me a little bit how dealing with mental health affected you as a student in terms of being able to perform at your fullest for exams and quizzes and different things during pharmacy school.
Right. I felt that mental health for me was a challenge. I only sought professional help halfway through pharmacy school. And so that's essentially 6 years, because I spent 4 years in undergrad where I was involved in like mental health, advocacy activities, but didn't take it upon myself to seek professional help. And then, I went through 2 years of pharmacy school, which is 4 years. So it took me a while to kind of, mentally allow myself to really go for it and seek professional help. I think the longer I put it off, the longer I was trying to justify perhaps not needing it, especially because I was in certain student leadership positions where I was advocating for campus and community resources, both in college and during pharmacy school. Somehow that kind of that snowballed into this mental barrier that stopped myself from seeking professional help, and so that was very tough, especially when I was observing classmates that were in multiple leadership positions, that were also studying for exams and doing well on them, and they seemed to have their stuff together, and I just did not. And I don't know that I ever perfected it. I did thankfully graduate, and I worked a research, like non-traditional research job in industry after graduating. But that was definitely a challenge that I'm still to this day coming to terms with.
Pharmacy school is different than well, I guess I don't want to say just pharmacy school, just grad school in general is a little bit difficult because, you know, when you're in high school or college, most people for the most point don't have like all this outside stuff. But when you're in pharmacy school, there's a lot of people in pharmacy school who, you know, have families, they have kids, husbands, you know, maybe sick parents. There's a whole lot of other stuff they got going on top of the fact that pharmacy school is already stressful. So if someone was kind of feeling overwhelmed in pharmacy school, what advice would you give them having been through everything that you've been through already?
Definitely. So I agree. First of all, like there was a great diversity in my class, my graduating class, from every angle. And something that stuck out to me was sort of the lifestyle where you had parents, you had folks in positions where they were caring for their family, whereas myself, I'm sort of coming off of undergrad, and my family sort of takes care of me. And so I have that sort of traditional student maybe angle on it. And so there was a lot of wisdom that my classmates were able to offer. My advice is to sort of gauge what student groups really have your best interest at hand, especially from a well-being perspective. So both mental health and physical health. I think there are often tough moments where if I was involved in a certain student group or activity where they rightfully prioritized kind of the numbers of attendance at an event or an outreach initiative, sometimes it would be tough to prioritize those things with your own mental health and well-being, especially when the greatest priority is our grades. You know, we've got to get certain minimum scores on our exams to get through the program. I think finding a friend group, whether it manifests as a fraternity or a student group or just friends that you happen to make, that really puts your well-being, your physical and mental health as a high priority at hand. That would be my advice.
Talk about your mental health in terms of your transition from pharmacy school to, I guess, the real world when you were working. Did you feel like it got better? Did it get worse? Or what was that like?
Right. So I'll say internally within the pharmacy school program. So I was at a 4-year program where it's 3 years of academic and then the last year of rotations. I first want to say that going into the rotations for me was very helpful because rotations sort of had, within each rotation, you had a level of consistency in the routine. Depending on the rotation, you know, the day starts at a certain time and the day ends at a certain time. Rotations, not surprisingly, are you know, aligned with the schedules of a real world employee. Whereas when you're studying and have like student orgs the 3 years prior, that for me was very shaky and varied from one day to the next. And I would say the same was true for when I worked my first job after graduating pharmacy school. I worked as a medical writer for a small clinical research organization that was in Rockville, Maryland. It dealt with clinical trials in which I did research and looked at client pharmaceutical companies that had new candidate molecules. So that for me was this sort of consistent routine. It was a conventional like 9 to 5 kind of office role. I would say that for myself, I resonated with that kind of occupational lifestyle for me more so than maybe practicing like in a conventional retail or hospital setting where you're on your feet, quite literally, you know, attending to patients, attending to teammates in very much real time. For me, I would say the industry occupation or regulatory or anything outside like regular practice starting out was something that helped me establish a consistent day-to-day routine. And I think with my mental health, like I have bipolar disorder, a way to keep my mood kind of leveled on the day-to-day is to keep the routine consistent on the day-to-day. And again, to wrap that up, rotations as well as the typical kind of 9 to 5 setting after graduation, I think for me really enabled that.
Do you think if someone was dealing with mental health issues, in pharmacy school, they should maybe take some time off to try to seek counseling or help before they start working a regular job? Or do you feel like going straight into a job kind of helps?
I would absolutely recommend taking time off, especially for sorting out the needs for your own mental health, because that can vary from one person to the next. I actually did take like a month off in between the time I sort of my manic episode began to kind of calm down. I had to go to a inpatient behavioral health hospital, and then my parents sort of helped expedite that process for me to get discharged. And coming from a South Asian and Indian family, I think there was a lot of pressure and conflict of interest where my family really wanted me to graduate sort of on time, within that conventional 4-year, PharmD program. And I did take a month off where I missed some exams and things, but I felt some sort of family and cultural pressures to limit that time off to a month. But I would advise that if you have the capacity to take as much time off as you need and are able to really hash out a compatible mental health care provider, whether it's a psychologist, a psychiatrist, a counselor, a therapist, or any combination of those, and get you on a routine where you've already done the trial and error. For me, I took Zoloft and I got a manic episode from that. Later on down the road, I took lamotrigine to calm my mood swings. Then my body broke out in a rash. So I was doing that trial and error while still in school. I think it would have been much more smooth if I took like a substantial year off. And I really recommend that. But I think I was tied up in this like South Asian Indian culture where we are pressured to really graduate on time. And that's tough. So really, if you can advocate for yourself, take the time off that you need, talk to your academic advisors, and really convey that you may need some time off to really hash out the regimen, the treatment, the plan that's right for you. That is what I would recommend.
Okay. I was reading something that you sent me. Was this a blog or article that you wrote? Nurturing Mental Health, a Personal Medication Safety Experience. And one thing that really stood out to me, and I'll read this, you wrote, I was even forced to believe that only patients of healthcare providers experience certain struggles, and it wouldn't make sense for the providers themselves to be struggling since they're the ones who are supposed to help. And to me, when I read that, it's like, as a pharmacist, people come to us for advice. So a lot of times we don't want to seek help because we're the ones to help other people. That's kind of how I took that. Tell me what you meant by that. I thought that was an interesting intro into that paragraph.
Right. Yeah. I think the way you interpret it was spot on. And I think that was a sort of a strongly held belief, albeit an incorrect one that I had like really deep down, perhaps subconsciously, that sort of who am I to seek professional help when I'm sort of in school to be on the providing end down the road. And that is something that I struggled to grapple with in school. I think the professors and the faculty in pharmacy school, they were really looking for candidates and graduates that were really tough, for lack of a better word, and I found it difficult to be vulnerable. And I think the very fast pace just sometimes felt discouraging for me to really slow down as an advocate for myself. And I think this informed my career choice as well. Again, although I graduated from pharmacy school, I've never practiced in any sort of patient care setting. And to this day, I'm still hesitant to do so or consider it. But I do hope that moving forward, I sort of come to personal peace with the fact that it is okay for a healthcare provider to seek help for themselves and their own healthcare, particularly in the mental health space. And I think when I wrote that in the blog, that was a way of being vulnerable with a personal kind of perspective that I needed help to evolve and sort of become more transparent with. So yeah.
I know even for me, when I was working in retail, even though it was stressful, I didn't have depression while I was working, but there was definitely stressful times and times where I was frustrated. And the thing that kind of stuck out was that technicians or family members, they never understood. They said, "Oh, you make all that money. What are you stressed for?" And I think people have this kind of stigma because you make so much money that you should be fine, or that money is, money brings happiness. But it still was stressful working in retail setting, being kind of understaffed and overworked. And I think that's why a lot of people don't seek help too, because they make so much money. They kind of feel like they're complaining and they should be grateful. But I think that that's not the case. I feel like no matter what your salary is, if you feel overwhelmed or having some mental health issues, that you should seek help right away. And I think that you talking about this and us doing this podcast, hopefully we can help somebody out there who kind of feels that same way, that because they're a healthcare professional, that they'll be more willing to seek help. So I thank you for coming on this podcast. I know you said that I'm going to post the link to the article in the description. Please check it out. Please read it. I know you said that you did comedy. Is there anything that you want to, social media handles you want to let people know to go check out?
Yeah, so I have a few comedy videos on my YouTube channel. It's youtube.com/mooditverma. It's my first and last name. And then on several socials, my social handle is I like to mood it. So it's like I like to mood it, or move it. So it's I like, then the number 2, mood it, which is my name. So that's Twitter, Instagram, TikTok. That's my social handle.
Okay. And since we're talking about the comedy, how would you say the comedy helped with your mental health issues?
Yeah, so I'm relatively new to the comedy scene. I've only been doing it since fall of 2019. And I was hesitant to attempt comedy during my time of employment, full-time employment, that is, after graduating pharmacy school, because I think I was so tied up in trying to adjust to the job in this medical writing role. And so after the company got acquired and rapidly moved to Florida, I live in Maryland, so I wasn't ready to do that in such a short timeline. I had this time off in front of me to kind of like pursue my bucket list item, and I took a deep dive into stand-up comedy. I think for mental health, I was able to find a community of folks from a variety of backgrounds and a variety of occupations. And I think there is this sort of overlap, this strong overlap between folks that have experiences pertaining to mental health and folks that participate in stand-up comedy. So I'm very thankful to have found that community for sure.
Yeah, I recommend anybody who wants to try stand-up comedy, just go to an open mic. It's real lighthearted. I think all healthcare professionals should have a hobby that they like, and I highly recommend other people try stand-up. Well, hey guys, thanks for listening. Hopefully this will help people. Thank you for coming on, Dr. Verma, and you guys have a good day.